You will now read more on the potential content of both process trainings and trainings as activities of community-based MHPSS programming and how these might be organized. Training is a necessary component of any community-based MHPSS program in an emergency setting. Training can provide the nexus between humanitarian response, emergency preparedness, and long-term development. Skills learned can be reactivated and can contribute to the long-term resilience of a community and a country. This is especially true when training builds the agency of affected people, which is at the core of community-based MHPSS. In an emergency, people are usually asked to respond to situations that are new to them and that challenge their existing capacities. The emergency may demand additional capacities that were not present before the crisis took place. In order to respond effectively and responsibly, helpers, including those within MHPSS function, require training and technical support. Trainings can be part of the process of implementing a community-based MHPSS program. Trainings may also be a specific activity or a deliverable of that program. Process trainings tend to focus on capacity building for a program as it was designed. Training as an activity meets a broader capacity building objective for community-based and countrywide MHPSS response. The difference between these two is not necessarily rigid, but it's a useful guide. In order to organize trainings in a community-based MHPSS program, a crucial step is mapping and partnership. Assessment and mapping should include an evaluation of existing capacities and gaps, including training needs and training resources, and available trainers and supervisors. This will help to determine the budget required for project planning. Through these mapping and partnership activities, a training plan will be developed. Process trainings might be offered to staff of the MHPSS program, including PMT members, other units of the organization, including livelihoods, protection, and conflict transformation units, implementers and implementing partners, including other agencies, organizations and civil society partners, the sector under which the program is implemented, including CCCM, technical supervisors, and MHPSS managers. There are three common types of trainings as activities of programming: mobilization and capacity building of existing community-based resources. Identified community resource persons might include existing formal and informal sociocultural activity groups, artistic, interest and sport groups, individual artists, sportsmen, religious and traditional leaders, and activists. The aim of this would be to enhance the general capacity of a community to respond to a situation. Training in counseling and specific psychological interventions. This might involve brief training in specific psychological interventions like PM+, which allows more people to be trained in a relatively short time, and/or capacity building of selected individuals in the foundation of counseling and psychological care over a longer period. The second option takes more time and can be resource intensive, but it allows for a broader and more flexible skill set and is the preferred approach of IOM. Academic professional courses. One main feature of IOM community-based MHPSS programs has been the organization of executive master's diploma and certificate courses. These courses have taken place from the Balkans to the Middle East and to South America and are adapted to the specific needs and the cultural, social, and political conditions of the context. We will hear more about these activities shortly. Forms of training vary widely and depend on a combination of factors including duration, scope, focus, available resources, existing skills, and so on. When designing a training, it is important to consider the relationship between training objectives, methodology, and duration. For example, in an area where no one has been trained in MHPSS-related information and program resources allow for a one-day training, then this should be on psychological first aid rather than counseling. If the program aims to provide counseling skills, then longer-term training is required. Training staff of a community-based MHPSS program depends on the existing foundational skills of the team. In some settings, these foundational skills need to be created. In other settings where these skills are present, training may focus on harmonizing practices and addressing gaps that emerge from supervision processes. Training aimed at passing skills to use in the field should be organized in 3 steps: passing of information, knowledge, process, testing the acquired skills in a protected space through simulations, role-play, pre-post test, or other teaching methodologies. Testing the acquired skills in the real world through supervision and mentoring. On-the-job training, in which trainers join the team during the field activities, may be the most effective way to build capacity without slowing down the emergency response. Even this approach should include these 3 steps.